Hello guys, I'm Rakshith from Team Let's Learn. Today we have Amal Kumar who has recently passed his medical and induction psychometric test. First of all, very congratulations for that.
Thank you.
So today we are going to discuss a very unique topic, that is the induction psychometric, which is a very new thing for Anglo aspirants, which not many has faced and passed before. So today, Amal, can you tell me about the procedures that you have faced for this induction psychometric test?
Okay, basically it is a very simple test. The motive behind this test is to access your personality. So first of all, to after the interview email, the authority will call you for confirming your appointment. After the payment and the confirmation of your appointment, you will get a video call link for the test. So
Okay.
at the time period, you have to join that video call. There will be a psychiatrist will monitor you. You have to keep your video as well as mic on, uh, and there will be an option so that you can have the assistant from the psychiatrist if you have any doubt or etc. Basically, there will be two tests. First set of tests will have 25 questions, and after that test, you will get another mail regarding the second test that you have to join. That is the mail you got currently have the link for only the first test. After the completion of the first test, you will get another mail for the second test. Okay, then the first test will have 25 set of questions. 25 clearly recall it that after the first test, there will be second test, and it will consist of 195 questions. In the first set of questions, that is, you will mostly the questions are true of questions. Okay, the
Okay. True
questions
or
are like,
false? True or false? Okay.
yeah, and the questions are like, will you get angry easier, or how will you respond to a emergency situation if you see fire on board? How will you, or be like, uh, actually, I will become safe myself. I will press the fire alarm button. I will immediately inform the crew. So that kind of questions you have to. And my my tip is to be honest as possible. Only
Okay.
give genuine responses. If you are not able to give genuine response, or choose correct, or the option that you feel good from the, so there is a chance of making contradictory answers.
Yeah. Yes. Yes.
So that will lead to the video call with the psychiatrist. So
Okay.
they will ask what you have uh, responded when they asked that question on the test. So if you are not able to give the clear responses, so there is a chance of getting rejected. So my as possible. So this is the only way to crack psychometric test.
Okay.
It's a very
Amal.
simple test.
Okay. Okay. Amal, my first question is, you told something about payment, right? How much is the payment?
750 rupees.
Okay. And second, you told that there will be a video call while you're giving the exam, and it's not mandatory, right?
That actually it's mandatory. We have to switch on our camera as well as microphone. They will be monitoring us. We are not able to. We are not allowed to switch off our camera, but we have, there is option, but we have to keep our camera on. This we have to attend the CPT. They will be monitoring us from the behind.
Okay. So the thing is like the assistance is optional, but the video call will be always be on.
Yeah.
Okay. Next is you told me about the first test has around 25 questions, right?
25 or 30 question. I clearly
Okay,
don't remember
okay.
that.
Is there a difference between the first set of questions and the second set of questions?
Actually, I don't clearly remember that.
Okay.
But I think it is mostly first set of questions.
Can you repeat
And
that?
in,
Can you repeat that?
okay, okay, in first set of questions, you will have strongly agree, strongly disagree,
Okay.
agree, that
Okay.
type of options you have.
Okay.
But in the second type of questions, you have options like, as I mentioned earlier in the question of what will you do if there is a fire emergency?
Okay.
That is, I will inform the authorities. That kind of options are available in the second type of uh,
Okay. So in the second type of questions, that is around 195, there are many
yeah,
options.
yeah, they will give you options.
So for entire 195 questions, do you have many options?
No, you can also see disagree or agree
Okay.
for question. It's a like a mixed one.
Okay. Okay. So another thing is both the tests are online, right? Both the tests are online.
Yeah, both the tests are online.
Like so we have to appear online for those, and there might be a chance if they find any contradicting statement that there will be a video call from the psychiatric doctor so that they can assess you properly.
Yeah,
Okay. What is the duration of the exam?
if you give, there is no any time limit. You can take as much time as you want.
Can you give me some example of situation type questions that they asked and what answer you gave for them?
Okay, like situation type of questions. As I mentioned earlier, there is a question like,
About the fire, no?
yeah, yeah, yeah. Then I also encountered a question that like, what will you do if there is a that is floating in the sea? That type of question. What will be your
Can you
response?
repeat
How
that?
will you respond?
Your network is a bit bad.
Okay, and there will be also a question like, what is your response if you find a man in the sea, or how will you handle that situation?
Okay, what were the options for the fire one and this one, and what answer you gave?
Okay, uh, for the fire one, I give you option like, first of all, I switch on the fire alarm, and
Okay,
I okay.
and the second one?
Second one, I inform the crew.
Okay, you press the option that is I will inform the crew.
Yeah, that's right.
Any other examples that you like to give?
Uh, there is also, I remember, question like, did you have any trouble if there is a rules and regulation?
Okay. If you broke
Do
any
you
rules,
feel
if you break any laws like that, no?
get to broke any laws? That kind of question.
Okay, and what answer you give?
I gave never.
Okay, okay, like that. And they also ask you about your drug usage or alcohol usage, right?
Yeah, 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 yeah. Have you ever consumed alcohol or any other kind of drug?
Also, Amal, you mentioned that you are an introverted person, and the entire exam you maintained that personality for your answers, and they still didn't reject you, right?
Yeah, that's right.
So you tried being very honest with all the answers.
Yeah, yeah. I kept honest.
Okay. Is there any tips that you'd like to give?
One tip I have to say, you gave any not genuine responses, there will be a chance of getting contradictory answers.
Okay,
So
yeah,
this
yeah.
will lead to uh, the video call with the psychiatrist.
Okay,
That's it.
so you are telling that again they are trying this same strategy, that is repeating the question so that we can catch them in their lie.
Yeah,
Yeah, so they are using the same thing that was done for your CBT. They'll repeat the question, and if you put contradicting answers, they might catch you and again do a video call with the psychiatrist.
yeah. That's it. That's it.
Okay, okay. So that is the
Okay, the main objective is to measure that you are fit for the sea life. That's it.
okay.
And I also encountered question like, did you ever thought of suicide?
Yeah, okay,
Did you have any suicide tendency? And that type of question we also have in that
okay.
test.
Okay, any kind of questions where you tried not being the ideal human being, like they asked you, like you didn't answer everything as if you are a perfect human being. Like many people try to do that, no, for a psychometric test.
Yeah, I always try to be honest as
Yeah.
possible. I also given some negative answers also.
Okay. Can you give me some of the example for the negative answer that you give?
Okay, the first answer I think uh, they asked me about do you have ever feel stage fear or
Okay.
something question related to that, and I actually uh, give some moderate kind of responses.
Okay. Okay. And any other?
No, nothing. Actually I don't remember it
Okay.
clearly. That's the
Okay. I
problem.
understand that. Can you tell me, okay, you said there is no duration, right? Can you tell me the type of questions that you received? Like citizenship is one type. Any other type?
Our personality type questions,
Okay,
that is
personality.
okay, okay, how we mingle with the society, how we often we go outings, how much or the size of our friend circle we have. Does we have so many friends? Okay, are we a person who go out regular basis or have so many friends, like that kind of
Okay.
question.
So the entire procedure has been completed in one day itself.
Yeah, one day itself.
You got mail the same day or one day before?
Actually, I got mail from Anglo after one day from the test,
Okay, one day from after your interview, right?
from the psychometric test.
Okay, the results. I'm not talking about the results. I'm talking after your interview. After how long did you get your email for induction psychometric test?
Uh, After the interview, they will ask you for the submission of the
Yeah,
your documents.
yeah, documents.
After the document verification, I think it only took 2 or 3 days for getting the
Okay.
mail for psychometric test.
And they completed entire procedure in one day, and the next day itself you got the result.
Yeah, that's it.
Okay, okay.
The result will be like you have cleared the psychometric test, and the next mail will be regarding the medical. They will give you a appointment with the clinic that is nearby to you.
Okay. And how long did after this induction psychometric you got your medical mail?
Okay, the next mail that is after one day. That is after the psychometric test. The next mail will be like you have passed this test, and the next step is to follow the medicals, and they will attach the address of the clinic in that mail, and also give the phone number of the clinic. So you have to take appointment with that clinic.
And this clinic is optimized so that it's nearby you, right?
Yeah, that's right.
Okay, okay.
If you are in Kerala, they will the center will be in Kochi, I think.
Okay, in Kochi. Okay, okay. Anything that you'd like to mention specially about medical tests that we have? Like what kind of test was happened? Like if you're comfortable with it, please tell.
Okay, I will share my medical test experience. Is that okay?
Yeah, yeah, okay.
Okay, the first thing we have a urine test that will measure the creatinine level
Okay.
and is there any albumin protein present in our urine. And the next one is the blood test. In blood test, they will measure the WBC, RBC, HB, then uric acid, then glucose, serum thyroid, that kind of test. That is total blood test. Then there is a chest X-ray. They will take the X-ray of your chest, and after that, they will take the ultrasonic scanning of your thoracic area and the abdomen. And after that, there will be a treadmill test.
Oh, treadmill test
Okay,
for you also. Okay.
yeah, treadmill test is also there, and there will be also a test that is the chief medical officer will look you undressed. That is, you have to that he will check your private part. That kind of test is also there. That's kind
Okay.
of examination.
Okay.
That's it. That's
Mhm.
all about medical.
Did you get any like qualification for BMI or something like that?
Actually, they measured my weight as well as height, so I think they calculated my BMI. So I
Mm.
think it might be in the standard limits, and I'm not aware about that. What is the limit?
Okay, okay. You're not available then. Okay. Um, So I think that covers most of the questions. Anything extra that you would like to add for the entire procedure after interview?
Okay. For psychometric test, only my opinion is be cool, be
Okay.
honest,
Okay.
give genuine responses. That is only my uh, thing what I have to say. That's what I do for
Yeah.
clearing
Yeah.
the
Yeah.
that test.
And
And
one more
after
thing
medical,
that I would like forgot to ask is, did you do any kind of dieting before your medical test? That you fast before medical test? That is a common practice, right? Did you follow any of that?
yeah. After the mail, I got tested my blood from the nearby clinic. So I found that there is a little bit rise in the uric acid level in my blood. So I followed a diet to reduce that. That is the
Okay.
only thing I have done.
Did you like try to stop eating fatty foods, something like that?
Actually, I am a very lean person and I am okay
Yeah.
with that.
Yeah.
So,
Okay. Okay.
so that's okay with me.
Okay. Any tips, like you were saying something, right? And I stopped you in between.
Okay. Actually, I'm talking about the psychometric test.
Yeah.
So what I have to say is genuine responses.
Okay.
That's it.
Genuine response.
It's very simple test, very cool test. I attended that test with 1 hour of the mail. That is, I got mail from the Anglo, and within 1 hour I took the appointment for the test, and I attended very cool, and I give very honest opinions. It's very simple test.
Okay. And your document verification, what kind of documents were asked, and how did you obtain it?
Actually, I think there is a problem with the network. Can you repeat the question again?
Like for your document verification, some documents were asked, like AICT approval letter.
Okay.
So how did you
Yeah,
obtain it?
yeah. After the interview, they will ask for the different type of documents like passport copy, copy
Yeah.
of your 10th, 10th, 10th standard mark sheet, 12th standard mark sheet, degree certificate, and the scorecard of your if you're studying BTech program. And you have to also send a photo, then a copy of photograph, and you also have to send the AICT approval letter. They will send you a format and you have to submit that format to your college, so they will make the approval letter as per that format, and
Okay.
it should be in the letter pad of your
Okay.
college.
Of our college. Okay. Okay. So do
That's it.
you? I'm not sure if you know about it, but what if you don't have the degree certificate? Like what if you are still in your 8th sem or something?
Oh, actually, I don't know about
Okay,
that.
okay. I just assumed. I know you have already passed out. I was just simply asking. So I think we are done.
Okay.
I think we are done here. So I guess we can end here. Thank you very much for your
Okay.
time that we are putting so that the future aspirants can pass their induction also as medical. So thank you very much, Amal.
Okay. Okay. Also, I am also thanking you for taking this opportunity for making a that is like a uh, actually you are making a initiative
Yeah,
for the experience. Actually, it's a very good thing. It
yeah.
will help so many people.
Thank you very much, Amal. I think we'll stop here.